Hello and thanks for watching. Let's talk about surgical instruments for rat catheterization. I want to start by mentioning that your surgical instruments should not cause undue trauma or add time to the procedure. They should feel right and be the correct size. Remember, we're doing surgeries on rodents here, so it's important that your instruments are sized appropriately. They should be held correctly and maintained properly. If you take care of your instruments, they will last you a very long time. And of course, remember to sterilize them prior and in between your surgery with a bead sterilizer. I also want to add that instruments are very much so a surgeon's preference. The instruments that you will see here work well for me, and I hope they can also work well for you. Let's start by talking about scissors. This first pair of scissors are Wagner scissors, and they are sharp, and they would be used for skin incision and cutting external sutures. This other pair of scissors is very different from the first pair, and there is a reason for that. That way you can differentiate them and use them for their own purpose. One is used externally and one is used internally. That way you avoid a potential for contamination. So these scissors here are blunt. You can use them for your sharp or blunt dissection and for cutting your internal tissues and sutures. Now these spring scissors are nice and sharp, and they are used for incisions on blood vessels. If you cut anything else with them, we're talking about other tissues or sutures, there's a chance that it will get damaged. Now let's talk about forceps. This first pair of forceps here are Grafé forceps. They are curved. They have a 1x2 teeth at the tip. So they're going to be used to hold the skin during the incision. These forceps will minimize trauma on the skin when you do the incision. I use these vessel dilating forceps for other purposes. They have a nice blunt tip, which makes them ideal to work around the blood vessels. So they work well for blunt dissection and suturing also. The Moria forceps. This Moria is a straight one, and this one will be very useful when you do a carotid artery catheterization to temporarily occlude the blood flow. The forceps is placed under the artery and works very well for that purpose. So these are Dumont forceps. You can see that they are 545 as they are angled at the tip. The purpose of this forceps is actually to hold the vessel's incision when we insert the catheter. There is a correct way to hold instruments. Let's start with the scissors. As you can see here, the thumb and the ring fingers are in the loops of the scissors. The index is on the shaft, and that will give you a lot more control. And your middle finger is over the loop of the ring finger. The forceps is very easy. Your forceps should really be held like a pencil. Now, the needle holders, they come in so many different shapes, and this one vary a surgeon's preference here. My favorite one is the Cult needle holder. The reason why I like it is as a quick thumb release, and of course it will be used for suturing, but also to apply tension on the sutures. The hemostat will also be used for applying tension on sutures. The microserfin clamp is used for clamping the catheter. A retractor will be very useful when you do a carotid artery catheterization and doing the femoral vessels. You can use it with the elastomer to fix your catheter in place. This is a groove director. I really like that instrument for blunt dissection. So when we do the pocket on the back to accommodate for the disc of the VAB, this is a great instrument for that. Also works great for tunneling and guiding your catheter from one incision to the other. You're also going to need suture. This 6/0 silk is used to ligate the vessel and to secure the catheter in place. Silk is used here because it has great knot security. If you do not have any instruments, you can get a complete kit directly from FST. And this is it for this presentation. Thanks again, and you have a great day. Thank you.